couple of things before we get to our discussion that relate to some of the questions that have been asked. I will say that having now seen this film many, many times, I still choke up at different points, including at the end when Judge Wolfson hugs Trevor Dolan. That's not what you normally find with judges and those who are in front of them on with criminal charges. But it reflects some of the things that Steve has been able to do to transform this system, to create partnerships instead of adversarial relationships. We have already taken this film, not physically since COVID, but in other ways, to different places around the country. And frankly, I think we have an enormous opportunity here. It's a perfect storm where issues of criminal justice reform, mental health reform, and police reform have all come together. And there's a crying need and a desire in many places to have answers, and answers that can build some broad-based support. Some of you have asked where they can get access to the film and to the program today. Program today is being recorded, and before long we will have links, and I will and others will put them out on social media, and you'll be able to find them. But also the film itself and a lot of other interesting video outtakes in some cases are available at www.doifilm.com. DOI for definition of insanity. That includes the longer version, the theatrical version of the movie, which is about 75 minutes and provides some additional nuance. Judge Leifman, I'm going to come back to you with some larger questions about where you're going now and where we may be going in the future. Let me start, though, by asking Dr. Lamel. We know that when people with a mental illness are encountered by a police officer, often with calls that come from their families or from neighbors, that they escalate conflict. That's what they're trained to do. We know it often ends in tragedy, but we also know that if you are a person of color with a serious mental illness, that the likelihood that something bad is going to happen is magnified. And the same is true with the way people are treated in the criminal justice system more broadly. Reflect a little bit on those issues. And then I'd also like to ask you, since I know you have been deeply involved in questions of homelessness, about the intersection of all of this with the problems of the homeless.
Thank you, Norman and Judge Leifman, for inviting me to speak with everyone today. You know, I think these are two issues that have overlap, right? So one is the disproportionate overrepresentation of people of color in the criminal justice system, separate from the mental health system, and then an overrepresentation of people with serious mental illness in the criminal justice system. And where they overlap is sort of the population that we're talking about, that are even at higher risk of ending up being harmed by police in the process of trying to get help, being arrested and brought into the criminal justice system. And then once in the criminal justice system, getting caught in the criminal justice system for longer periods of time, and to have even more exposure to trauma, both because of their mental illness and also just because of the general treatment that people often get and people of color get in the criminal justice system. So there are two different social issues that are colliding at once, which puts people of color who have mental illness at a much higher risk of being abused, of increased trauma, and of frankly being killed in the process of trying to seek care. I do think that there are ways to improve this. And I think there are things that we can do. Obviously, social justice in general is something that we have to address. But I think in particular, thinking about mental health care. And when we're talking about mental health care, we have to also include substance abuse care, because I think often the folks that end up in the criminal justice system have been arrested for substance abuse charges. And people of color are often arrested for substance abuse charges at a much higher rate than non-minorities. And so we have to think about substance abuse in the same way that we think about mental illness, and require treatment for people as opposed to criminalizing them. So how do we do this? How do we shift? Because what we saw today in the documentary was sort of the end stage for a lot of people. Once they've ended up in the criminal justice system, and Judge Leifman's, he is doctor, Judge Leifman's program is a model program for helping people as they're coming out of the criminal justice system and coming back into the community. But I'd like to think about what we can do even before that. And really talking about preventive measures that we can do in the community. And it's a matter of prevention, early intervention, and then really good treatment, good evidence-based treatment around issues of mental health and substance abuse. And I think, as you were asking, Norm, one of the things we have to do is thinking about how do we not get the police involved unless we really need the police involved. And if we can get our treatment programs to really focus on prevention, early intervention, and treatment, we can prevent a lot of people from ending up needing these 911 calls to begin with by giving them a better level of care. And a part of the problem, I think, is the way we fund behavioral health care. That our behavioral health care systems, it's sort of funded as a one-size-fits-all. But clearly, when we're talking about people with serious mental illness and substance abuse and complex needs, they need a higher level of care than the average behavioral health system can provide. And they need specialty care, and they need care provided by clinicians who are trained in different ways to handle these higher levels of needs. But we don't fund our systems of care that way. So we have these little small specialty programs that pop up all over the place. And the Dade County program is one of these tremendous specialty programs. But how do we bring that to a higher level? How do we replicate that nationally? How do we provide that level of care, that higher level of specialized care in other parts of the United States? And I think that that's something that we really need to focus on, because one size doesn't fit all. And the people that fall through the cracks are the people with complex needs. And unfortunately, when we call 911 for these folks, the police are involved, things can escalate, and people end up in the criminal justice system when what they really need is the proper level of behavioral health care in the community.
That's terrific, thanks. And I should emphasize that one of the great innovations of Judge Leifman's program is to train 911 responders to know when the call involves just this kind of complexity and which team to send. And of course, one of the things we want to do is to make sure that the teams aren't just police officers down the road. That's something else we'll need to deal with. I'm going to come back to you, Stephanie, because I want to ask you a little bit more about anosognosia and what we do to deal with people with serious mental illness who have no insight and who are not given any opportunities to deal with those problems. But before we do that, I want to turn to my friend Rob Reiner. I want to add something to his introduction that I didn't mention. This is not just a remarkably talented person in the world of entertainment, but he has done more for early childhood education and care in the state of California than anybody else by spearheading what was a revolutionary move in a referendum using money from the tobacco industry, which he has also fought against for a long time. So Rob has a lot of credentials. Rob, I want to ask you a few things, and I'd like you to respond to whatever else you want to as well. When you struggled with your son when he was a young person with the addiction problem that led to homelessness and the unwillingness to get treatment for a long time, what brought you to do a movie about it? What made you think that that was a good direction in which to go? A little bit about the power of film, because that's what we saw when we decided to spearhead this documentary, and that it's not just airing a movie, but it's then using it to go elsewhere in programs like this and around the country. And then I'd also like to ask you about homelessness in California. Judy and I just made our first post-vaccination trip out to LA to visit our son, Danny. And I was struck as we drove around the city that it reminded me more of Bombay when we were there 30 years ago, with people in tents all across the city, than it did of what we would expect from a modern American city.
Yeah, well, there's a lot there.
Yeah.
First, I'd like to just say that you have the right people. I mean, because when I thought about these problems with mental health and with homelessness and drug addiction and child abuse and all of these things, they're kind of integrated, and it's very hard to separate them out. And in order to tackle the problem, you have to look at points of entry and say, what is the best way in to get the best possible outcomes? And my thought was, and again, it takes a, the old cliche, it takes a village. My thought was that if you could intervene early on, because mental health issues can be identified very early on, even in the first years of a child's life. And if you had the right kind of home visit programs, intervention programs, you could stem the tide of a population that enters into society with, a whole host of issues. But the way in which you're talking about it, I mean, I love that, to have an enlightened judge like Steve Leifman is just, a rarity. I mean, it's like a unicorn. I mean, I'm assuming that there are others that are pursuing this and helping out, but because you do need these different points of entry early on, the teenage years. We try to provide preschool and early health care and child care and home visit programs and aftercare programs. And there are certain models around the country. There are very few, but there's certain models that take this kind of organic, integrated approach. You hear these words all the time, integrated, comprehensive, they're thrown around a lot of times by people in public service. But the truth is, you do need that kind of system of operating in order to get the outcomes that you need. You can't, I used to give this, because I went all over the country talking about this, and I got attorneys generals involved, I got police involved, I got a lot of different people involved. And I used to give this, this analogy of, you see these babies going downstream and they're heading towards a waterfall, and they're going over the waterfall, these little babies. And you see somebody right before they go over the waterfall trying to grab a baby, and the babies are flying over the waterfall. And then somebody comes along and he sees this and he says, "What are you doing?" He says, "I'm trying to stop this. There are so many babies." And he runs in the other direction upstream. He says, "What are you going to do?" And he says, "I want to find out who's putting these babies in the water." And so the idea was that if we could get it at the source, we could eliminate some of that. But since we don't have that kind of investment, we do need this comprehensive approach where we approach it early on. We approach it with a mental health system that can deal with people with these issues. And then in the criminal justice system, to identify that these are not criminals of their own making. They are criminals because, or they are deemed criminal because they have mental health issues. So those are the things that I think about. And the reason I did a film was because, it's one of the best ways to reach people, just to put something out there that they can see. My son, Michelle and I, our son, we've been struggling with him since his early days, since the time he's a baby. And we knew something was a little different about him. And when he got into his teenage years, he started self-medicating, like many of them do, not knowing what the problem was. And I would say that, drug abuse and mental illness are hand in hand, because there's nobody that takes drugs if you feel good. If you feel good, you're not throwing a lot of drugs into you. But if you're not feeling good and you don't feel right with yourself, you're trying to do anything to make yourself feel better. And then you're down the road. Now, the serious mental health issues of schizophrenia and those kind of bipolar disorders, the schizophrenia happens in the late teens and early 20s, and you see psychotic breaks. Then it becomes kind of obvious that you've got somebody dealing with a mental health issue.
But we also had
And
cops.
and we had police come to the doors. We had everything you can possibly imagine. He went to rehab programs. He, we took him to the Yale Child Study Center. We did everything possible, and still it holds on. When he was semi, normal, conscious, and relatively drug-free, we made the film, and it was at the time cathartic. But he, as you know, as Stephanie knows, is a lapse back. There's a lot of relapsing going on. And then in his 20s, mid-20s actually, he had that psychotic break that Norm talks about with his son. And then you're dealing with something that's serious, that it's very hard to get a hold of. And anosognosia, which you're going to talk about, which is the mental
Lack of insight.
patient
Yeah.
with mental illness has a lack of awareness that they have anything wrong with them, and they don't want to take the medication. They don't want to be treated. That it gets very difficult. So what has to happen is you have to start early on, and it's not simple. This is not simple. And people like Stephanie and therapists and doctors all over the country have been weighing nature versus nurture, and what is the nature part of it, what is the nurture part of it, and those things have to be wrestled with. But I thank God that there's people like Steve, because that's the last place to grab somebody before they go over the waterfall, and we need to have that as well. So I mean, I threw a lot out there, but I've been doing this for quite a while, and I headed up this commission in California for 7 years, and that's all I did for 7 years, and so I got to see a lot of this. There are programs for women in prison who give birth in prison, and they learn that you don't separate that child from that mother, and you learn so that child is not going to be, because abuse fosters abuse, drug abuse or child abuse, they continue. So you have to find ways of breaking the cycle. And like I say, there are many entry points, and we have to focus on all of them. But this one is, I love to see that there's a judge who's actually thinking about this. Steve, I just, I can't believe there's somebody like you who was recognizing this. And how many judges around the country, I'm asking you, how many judges around the country, not just in Miami-Dade, or in Florida, but all over the country, think the way you do?
I think we're seeing a major increase. Judges are becoming a lot more enlightened about the issue, because when you're sitting there, you are the one that's making the decision to release people back to the street. And vast majority of people with mental illnesses, and the way 90%, they're not committing violent crimes. They're going to go back. And you know that you're going to be releasing somebody back to the street in a terrible situation. And so I think my colleagues have really come around on this issue. And we have Stephanie and I work on an initiative called the Judges Psychiatric Leadership Initiative. And we have 4,000 judges and psychiatrists now linked together working on these issues. So I think you're going to see a lot more of it. And with the Supreme Court initiative, it's going to really improve.
Yeah, well, I spent some time with, at the time, Eric Holder was the Attorney General, and I spent time with him trying to develop programs through the AGs around the country, and also to law enforcement. I mean, it's unfair for law enforcement to be sent to a crime scene or a family upheaval, and to be therapists or to be mental health experts. They're not trained to do that, but they may be trained to recognize something. They can't obviously, dispense mental health help, but they can identify it. And maybe then, instead of, dragging right to the criminal justice system, they're putting them in a mental health system. But you have to build that mental health system for it to be there. Otherwise, there's no other place for them to go.
Steve, to follow up on one of the things that Rob said, you started this program with misdemeanors and then moved to nonviolent felonies. What proportion of those involve drugs? In other words, how much do we see this interrelationship with those who have a mental illness who are self-medicating?
It's almost all. It's 90%, 85, 90% are what we call co-occurring, meaning they have both a serious mental illness and substance use disorder. But I also wanted to follow up on the other point that Rob made, which was so critical, and it's moving upstream. We know, for instance, that 92% of all the women in jail and prisons in the United States with serious mental illnesses have these horrific histories of trauma. And about 75% of men in jails and prisons with serious mental illnesses also have these horrific histories of trauma. And for women, it's usually sexual abuse as little girls. And so what happens is trauma, and I get to speak as the doctor since you called me once. Trauma is a physiological reaction. It's not an emotional reaction. It basically, and this is a very basic explanation, it's an overdose of cortisol of the brain, and it can break the brain. And a young brain that's exposed to so much cortisol is damaged more than an adult brain. And so there is this assessment tool called ACEs, the Adverse Childhood Experience. And we know that if you have a score of 4 or above, there is 100% chance that that individual is going to end up with a substance use disorder and or a mental health disorder. And so what we should be doing, and they're trying to do it in California right now, is we should be offering that assessment to every middle school kid in America, identifying the issue now and getting them access to treatment, and stop allowing them to grow up into our criminal system because we didn't get them the access to care that they needed.
And that's the prevention part of what I was talking about, that, and as Rob was saying, you have to start early, and we have to screen. Now, I wouldn't even wait for middle school or high school, that we have to screen in the elementary schools and in the pre-K programs, and really look for the trauma. And Norm, you had asked me about housing, and I sort of left that out, but if I could go back to that for a moment.
Please.
I think it's not just about treatment and giving people pills, I think, as Steve had said in the documentary. It's really about understanding who the person is, and the trauma that they've experienced, and the other social determinants of health that they have to deal with. Housing is one of them. Having unstable housing, being homeless, is a huge risk factor for substance abuse exacerbation, mental illness exacerbation, and trauma. And it's not just housing. It's about having a decent education. It's about being able to find a job. It's about not living below the poverty line. I mean, for people with serious mental illness in our country, when they go on disability, by definition, they're living below the poverty line for the rest of their lives, unless they can come off a disability. And living below the poverty line puts you at risk for all sorts of other problems, nutritional problems. And when you're talking about people who are marginally housed or who are homeless, we always say this to our psychiatrists in our fellowship program. Like, how do we expect people to be adherent with treatment and take their medications if they don't even have a clean glass of water, if they're living on the street? They don't have a change of clothes, they can't take a shower, but we expect them to show up in a clinic once a month to get medications and get treatments. It's not reasonable to expect people to do that if they have no stable place to live. And then when we get to the question of insight, which you had also asked about, anosognosia, or lack of insight, I think that for a lot of people, it's episodic. These are chronic illnesses that have periods of time when people are doing better, there are periods of time when people do worse, and their insight around having a diagnosis or an illness that requires treatment may be very limited or may not exist at all. But they're still people, and they're people who have needs and desires and goals around other aspects of their life, like maybe going back to school or getting their parents off their back, if the parents are trying to force them into treatment, or they want to have a relationship. There's some goal that people want, even when they have mental illness and substance abuse. And part of our job as clinicians is to address those issues and engage people around those issues, because once we've got a trusting relationship with someone and engaged with them, then we can talk about the actual treatment side of things. And there are times when we have to treat people against their will. We try to minimize that as much as possible. And we really try to take a recovery-oriented approach to thinking about treatment. And engagement has to come first. And in New York, we've had a real emphasis on recovery-oriented teams. We have these intensive mobile treatment teams, and we just recently got new funding to increase the number of intensive mobile treatment teams. They're like assertive community treatment teams, but they're actually funded slightly differently, so they actually have more flexibility than our and our ACT teams. And they really try to help people by joining with them where they're at and finding out what's motivating them to want to take better care of themselves. Because people do want to take better care of themselves. Nobody wants to be homeless. No one wants to be addicted to Medicaid, to drugs. Nobody wants to have a mental illness. And so helping people to find goals and then work with them around trying to attain those goals. And in the process of doing that, getting them engaged in treatment. That's the way that we can get around the lack of insight that people often have about illness. Because we're not going to call it illness. We're going to treat it as though it's illness, but we're not going to call it that. We're going to engage with people around their lives and their goals.
I want to mention a couple of positive developments that I see out there. One related very much to what you just said, Stephanie. In the Rescue Act, we have direct payments going to families for their children. Right now, it's only going to be for 6 months, but it's going to cut child poverty in half.
Mm.
And if we continue that, if we provide a floor for people, that will make a big difference. And of course, we're going to face the additional challenge now fighting upstream with the additional mental illness and the trauma that the COVID has presented to us. So we've got that. The other is that next week, we're going to see a bill introduced by Senator Chris Van Hollen of Maryland and Karen Bass, a representative from California, that will provide all kinds of incentives for communities to have mental health professionals and social workers go on these calls where there are crisis situations with people with mental illness. An argument being that police are being asked to do too much. And if we can do this in a fashion that isn't just antagonistic towards police, but tries to build partnerships while making the situation better, we may help. We've had a couple of questions, including about whether this is the same as drug courts and simply mental health courts. And I'd like you to address that, Judge Leifman, while pointing out that the beauty of your program, as much as anything, is the understanding that it's a comprehensive approach. It's not just going in front of a court. It's providing the housing, it's providing the support, it's carrying out through the course of a year. It's finding all of these partnerships. So, but talk a little bit about the question of whether this isn't just the same as what we see in other places that have mental health or drug courts.
Thank you for the question. It's very different. The actual court part of what we do is almost the least of what we do. The problem with most mental health and drug courts is that they only take about 0.1% of the people that need the services. And often they may cherry pick and take the individuals that are the lowest risk. And the data and research show us that those low risk people don't need court supervision. In fact, by supervising them too much, they may end up more in jail than they would have had they not been in the program at all. And, you know, part of what we're trying to do nationally is teach prosecutors and DAs to learn to take the higher risk people because they're all getting out anyway. And if they're going to get out, make sure that they're leaving with treatment so that they don't reoffend. And so this is a much more comprehensive approach. This is both pre and post arrest, and there's several programs within our program. We have an assisted outpatient treatment program that we put together. We have an alternative competency restoration program. We have 8 peers that work for the court. 4 of them are graduates of our program, Justin, who you met in the video. We have a team of about 25 people that actually run this system for the entire county. And we take all misdemeanors, and we take, you know, all nonviolent felonies. So these programs need to be scaled up, not just a small percentage. And I just wanted to follow up, Norm, something you said, and I am optimistic on some of the things that are happening, but I also am a little nervous. I think it's wonderful that we have all this great new federal dollars coming into mental health and substance use, but I don't want to see those great new federal dollars spent on the same system that's incredibly ineffective.
Yeah.
Right.
And it is. We don't have a system of care. A lot of communities don't have any crisis care. One of the projects that Dr. Lamel and I worked on for the last almost 5 years was developing an ideal crisis system. Every community has a totally ridiculously different system of care. You know, you need to think about it like, God forbid you had a heart attack in Arizona, Alaska, or, you know, Hawaii, you're going to have the same healthcare system to address it. It's not that way for mental health. So just throwing these great new dollars into that ineffective, not system of care isn't going to help. And we need to work with the insurance industry also to get them to do their fair share, because they're pushing a lot of individuals into the public system that's already overburdened and under-resourced. And so this project put on by the Group for the Advancement of Psychiatry is an amazing report that for the first time lays out what an ideal system should even look like. And that's where money should be going, is to build those kinds of systems of care.
And Steve, if I could just add to that, you know, our report is focusing on crisis care. And just, you know, sort of the quick lay of the land is that right now, if you call 911, you either are brought to an emergency room or you're brought to the criminal justice system. And if you go to an emergency room, you're going to be evaluated and either get admitted or be discharged. And that's very limited. And sometimes people need other levels of crisis intervention that address some of those social needs that I was talking about. So someone might need a housing application. Someone may have gotten into a fight with their roommate or a family member and they're out on the street, and there needs to be a family intervention. Sometimes people run out of their medications, and the only way that they can get a refill is to go to an emergency room. So the crisis systems that we're talking about developing is a spectrum of care, starting from just having someone to talk to, which could be a peer or a social worker who can just sort of sit down and talk with someone, all the way up to having someone actually take a respite and stay for a few days and have, you know, several things put in place for them before they leave. But they don't need the level of an emergency room, and they don't need an inpatient hospitalization, which costs a heck of a lot more than a crisis system of care.
And we don't even talk about this enough. Most of this population, not when they are in crisis, not only have a psychiatric crisis issue, they have huge primary health issues.
Right.
The main reason they get admitted is because their blood pressure is so high, they're worried about a stroke, or they've smoked so much they have cancer, or diabetes. And so by not addressing these issues early on, it is so expensive with very poor outcomes. And the other part of the problem is, if you have pieces, the essential elements of recovery, they are so fragmented in a community that even if you didn't have the mental illness, you couldn't access it. And that's why we're building this one-stop shop in Miami, and it'll do exactly everything Dr. Lamel just talked about. If you just want to go hang out and you're a high utilizer and you just want to relax and talk to someone, that'll be there. If you need crisis care, it'll be there. If you need short-term residential, it'll be there. If you need primary health, dental health, eye clinic health, it will be there, all in one location. 200 beds of housing so that you can stay there and recover. And instead of just kicking people to the curb once we've adjudicated their criminal case, but not address their mental health or primary health needs, this will be a slow integration back into the community with all the resources they need to maintain the recovery that we've helped them get to. And that's the kind of thinking that has to go on, is just start thinking about it like other illnesses and not crimes. You know, we didn't say this, but we need to reiterate it. People with mental illnesses are no more dangerous than the general population. Tragically, they are much more likely to be victims of violent crimes by a far, far percentage than perpetrators of violent crimes. And recovery rates can be very good if we start early and get them what they need. And we just don't do that. We wait and wait for them to get sick, to die, to get horribly ill. And we just don't have to do it. And we know, because we've been doing this for 20 years, if we do it differently, you get much better outcomes.
I want to follow on by just noting that that's absolutely correct. In the very small number of cases where you have somebody with a serious mental illness who's involved in a horrific crime, it's because they're untreated. And they are untreated because the system's broken at all levels. But a part of it is that you will not get treatment unless, as you know, the standard, which is an imminent danger to yourself or others in most places, which means you almost literally have to have a gun to your head or a knife to somebody's throat, means that the warning signs are simply ignored until it's too late. Judge Leifman and my wife, who you met earlier, Judy Harris, are part of a working group trying to look at that standard and change it in some fashion, while also noting that if somebody doesn't have an insight into their own illness and is over 18, to leave them to their own devices means that you're leaving them free to freeze on the streets as homeless people, or to have terrible encounters with police and end up in solitary confinement, which will only make it worse. So we've got to look at this at so many different levels. But what Judge Leifman's program shows is that you don't have to throw money at this program, at this problem or set of problems, especially if you're just going to put it into the same failed system. You can save money at the same time. We're going to take our film around the country whenever we can physically travel. For those of you out there who have an interest in bringing something like this, the documentary with a discussion to try and spread best practices, let us know. We're going to be limited in what we can do, but we're certainly going to try to make this work more broadly. And obviously, we've got problems with the criminal justice system, the police system, and the mental health system, all interrelated. And I think the beauty of a lot of this is that as we look at the movement to reform police, and we're not just looking at encounters with people who have a serious mental illness. We've seen the body cam footage and other footage too often of people who were brutalized or killed, even if they don't have any sign of a mental illness, far more often than not, people of color. But if you can change the culture of the police, then you save lives across the board. They change the way in which they deal with these things. Rob, I want to come back to you for something that I mentioned that I just like to get your view on. The shocking level of homelessness in Los Angeles, and so much of it we know is because of the failure of the mental health system, but it's broader than that. Is there anything being done about that? California should be a place where they ought to be more enlightened rather than less.
No, and it's so tragic because my wife was involved in trying to create housing for homeless vets. I mean, we started with veterans. These are people that serve the country, and we had thousands, tens of thousands of homeless vets on the streets. And if you go into the VA near on the west side, you'll see, like you say, Tent City, right outside the gates of the VA, and and there's an enormous amount of acreage. There's hundreds of acres there, and you'd think, well, why can't we build something? But you have two problems. One is the mental health issues and anosognosia, as you point out. A lot of them don't want to. They don't trust. They're paranoid. They don't want to be helped. But there are ones that do. And so we have to deal with the ones that really do want the help and start focusing on it. I dealt with the guy who was running the VA, and the red tape is just astounding. I mean, to try to, work your way through it. And lately I've heard here in Los Angeles, they're thinking about taking all those people on the west side, or in those tents, and then their solution is, well, then put them at the beach. I mean, what is that? How does that help? Yeah, we all want to go to the beach, but not that way, it's a real problem. And I think a lot of it has to do with, yes, mental illness and the tremendous divide in the haves and the have-nots. We're living in a, like you say, it's Calcutta. I mean, you think you're in some, third world country, but living next door to people who have millions and millions of dollars. So it's pretty horrible. And I don't know that anybody has a solution to it except to do the things that you're doing, which is to treat people, to give them an opportunity, to give them an alternative if they want it. And that means mental health facilities. It means housing, as Stephanie pointed out, we need to start focusing on that, because it's just going to get worse. It's just going to get worse.
In all fairness, though, I think we do have to make the distinction between what the behavioral health field, the mental health field, can do and not do. And housing is a problem in this country because of social justice issues. And I don't know that clearly we're talking about people who have, substance abuse and mental health needs, who are homeless, and they're a subpopulation of the homeless population in the United States. And I think that we have to realistically address social justice when we're talking about issues of poverty, when we're talking about issues of housing, when we're talking about some of these other social rights that we would hope that people in the United States would have that they don't have. And it's compounded for people who have mental illness and substance abuse. But I don't think that the mental health system is the answer to that. I think it's about how we spend our money and what we prioritize. And, you know, putting people out on taking people in tents and moving them out to the beach just makes no sense to me whatsoever. You know, but taking that money and building low-income housing and then wrapping support services around it, or as Judge Leifman is doing, you know, for folks who have serious mental illness, who need a higher level of need, taking our money and really investing in programs that actually can support the whole person and not just the mental health aspect of it is the way we should be thinking about spending some of these federal dollars that are coming. And it's not just the behavioral health system or mental health system alone. It really is a social justice approach to the inequities in our country that I think we have to address as well.
But don't you believe that it's intertwined though, isn't it?
Absolutely intertwined. Absolutely.
We, even before the project that we run here, Miami-Dade was the only county in the United States that had a dedicated tax for homelessness. We have a penny sales tax on restaurants that make more than $400,000. And with those dollars, we were able to reduce our homeless population from about 8,000 to 1,000. And the 1,000 that are left are primarily this very acutely ill population. We've eliminated economic homelessness and veteran homelessness. But what we have left is mostly the substance use and mental health population. And that's why this building is so important. It's kind of the next logical step to do this. And there are strategies. It's just that there's so many silos in the system and nobody wants to give up any of their money. And I think one of the reasons we were as successful as we were is because I'm a judge and I was able to bring people to the table and, you know, they had to show up. Right. And, you know, we embarrassed them almost to giving up a little bit to get a little bit. And it worked so well that we've saved real savings, because when you close a jail, it's 12 million bucks a year for us.
But you mentioned, I'm sorry, go ahead. I'm sorry.
Okay, I'm finished.
No, I was just going to say, you mentioned the silos and how this funding comes down these silos and nobody wants to give up anything. And you hear those words, comprehensive and integrated, but you guys are actually doing it. And that to me is what is the model, is to find ways of taking the criminal justice system, the mental health system, and integrating them in a comprehensive way, which involves not just mental health treatment, but also physical housing and all of that. And that's the way it needs to be approached. And so lawmakers and need to be thinking about it in terms of that comprehensive integrated approach. Otherwise, you're just throwing money down the drain.
And the irony is, with technology, it's not that hard to do anymore. So we have something called the HMIS system. It's the Homeless Management Information System. We're hooked into that. So we are able to like figure out where beds are and how we move people to a bed. And it's not just about low income housing. You don't want to, you know, in my opinion, you want to do mixed housing so that you don't build slums, and you want to uplift the entire neighborhood. And so businesses move in. So there's a project in New York called Navy Green. It is gorgeous. And you have a multi-million-dollar townhouse next to a supportive housing project, next to an affordable housing project, next to a low-income house. And everyone shares a green.
Right.
It's magnificent. And businesses moved in, the property values went up, no crime. And that's the new thinking that we have to do. And the thinking's there, but the policies and the laws aren't really there, and the funding to make that kind of thinking work.
And I think the emphasis has to be on, instead of these siloed funding mechanisms, having bundled funding mechanisms that allow you to create these sort of unique environments. I mean, I think New York is ahead of the game in a lot of the creative ways that housing, low-income housing, has been incorporated into sort of middle-income housing and mixed-use housing, which really has benefited people with serious mental illness, and also affected folks who have other complex needs beyond mental illness, but you know, trauma, victims of domestic violence, the veterans, I mean, a whole group of people who actually need that kind of support.
So we're at close to the end of our time. There's so much more that we could talk about. I wanted Steve to reflect a little bit on his assisted outpatient treatment program, where he's taken these people who are homeless and deeply schizophrenic and managed in some instances, partly because of the advent of long-term injectable medications, which are very, very helpful to turning some lives around there and creating some insight, at least for some of those. We can talk more about the strategies that we could use to try and bring about this kind of integration. The difficulty that exists politically with, in Los Angeles, we have a lot of homeless who are living by Silver Lake in a park, and all the liberal people who live there don't want them around anymore and are trying to boot them out. There are difficult political issues that cut across the spectrum when it comes to providing some of these solutions, but it's also requiring transformational figures like Judge Leifman, actors who are passionate about this, like Dr. Lamel and Rob Reiner, and all of us to try and change the psyche of political figures and actors who actually make some of these decisions, including those in the medical healthcare system and the hospitals and the insurance companies, to look at different ways of approaching this and bring it around. We may have an opportunity here, partly because we do have a lot of money flowing out from the federal government in the aftermath of COVID. And we have an administration that may have at least some figures who are going to think about this in a different way, although we're going to have to fight to make that happen. But it's going to have to be done in hand-to-hand combat, city to city, community to community, much less here in Washington. The Addiction Policy Forum has been at the forefront of a lot of these battles, and they deserve kudos, not just for helping us put on this panel, but for all the work that they do. Columbia University is really the center of the way psychiatry is grappling with a lot of these issues. And Stephanie, thank you for the leadership that you've provided. We've gotten a number of questions asking where they can get more information or how they can access the possibility of bringing a program to them. And you can go to the Addiction Policy Forum. You can go to the website that we mentioned earlier with the film, doifilm.com. You can go to the website for our foundation, which is mornstein, mornstein.org, and communicate with us as we try and take this battle and debate forward. And let's hope that we make this crisis something that really is an opportunity to bring about profound change, that we can use the money that might be available to be able not just to save those lives, but ultimately as an investment so that the society operates much better, and ultimately, as Judge Leifman has shown, so that we can save money along the way. I want to thank our panelists for all that they do and for joining with us today. And I would also like to thank the many hundreds of people who have tuned in and stayed with us. And this will not be the last you hear from us. Thank you all.